Good evening. My name is Karen Cicerelli. Welcome to my world. I'm taking this moment to tell you about how psychology affects what I do every day and how I interact with other people based on psychology. I'm not scripting this. I'm just trying to let it be very natural. Scripting is boring, as we well know. I talk to hundreds of people a week, and it's also important that I try not to offend them, that they may not have understood everything that was taught to them when they were in the hospital, especially when they were sick. And because when you're sick, there's a time that you're really not going to absorb everything that you need to absorb. So psychology really plays an important part. And you have to be able to turn on a dime and change the way you talk depending on who you have on the phone. When you're talking to the elderly, when you're talking to people in their 20s, their 30s, their 40s, you have to be able to adapt to make what you're saying to them understandable. I talk to hundreds of people a month, and it gets to be thousands in a year. And each of those people come from different backgrounds. They have different racial and ethnic backgrounds, different socioeconomic classes, and different educational levels. And my job is to teach them what they need to know about their health. So health literacy is a very big important point today with all our healthcare issues. And when I talk to them, I always try to make it sound very personal and keep a smile in my voice, because we've learned in our psychology class that when one person smiles, the whole room will smile. And I want to gain their trust, to be able to have them buy in. I had been wearing uniforms to work so that what I've told my superiors is so that I would blend in with the other nurses. But I have just recently started to wear street clothes because the patients view it as I must be of somebody of a higher stature and believable, like along a doctor, like as credible as a doctor, by wearing street clothes instead of a nurse's uniform. So that's another psychology type of little issue that I have done. So now I wear street clothes. In addition, we've also added on to what we do in the day, and I do help. In our family waiting room, we have an Otis Spunkmeyer convection oven. And we're making chocolate chip cookies, and it smells so good. And we're going to go around with our little baskets into the rooms, and the patients that can eat the cookies are given cookies, and their family members can also partake in it. And it really has gotten rave reviews. Each package, we place a label that says fresh baked cookies for our patients and their families. With warm wishes. This just comes to say that we hope you're feeling better with each and every day. Through this whole day, I always have my whoopee with me, Mike Wazowski, the end.